All right, it's 10:45. Good morning, everyone. Welcome to our next session of the DePaul Innovation Day. My name is Maija Renko. I'm a professor and Coleman Chair of Entrepreneurship here at DePaul University, and I am moderating this panel today on the topic of leveraging partnerships to move ahead innovation across disciplines. I have with me 4 distinguished panelists today. I have Dr. Fernando de Mayo, I've got Colleen Egan, Sheena Erete, and Stacy Ignofo. Each one of them will first take about 5 minutes to introduce themselves one by one. And after that, I have prepared some questions on this topic of leveraging partnerships that I will ask of all the panelists. Towards the end of the session, we will have 10 to 15 minutes for questions from the audience. So at any point during the session, if an audience member, if you have a question you'd like to ask, you can press the Q&A button, which is at the bottom of your Zoom screen. We will receive your question, but we will save it for the end of the panel. All right, so let's get started. First, I would like to introduce and welcome Dr. Fernando de Mayo. He is with the College of Liberal Arts and Social Sciences and also with American Association. Welcome, Fernando.
Great, thank you for the kind welcome. And I have to say how much I've enjoyed the presentations and discussions so far. It's really great to hear about this amazing work that's happening all over the university. And I'm grateful to be part of this panel. So I'll speak a little bit about my experience in partnerships, really at the intersection of social science and medicine. My base is as a sociologist, but I've also had the pleasure of working very closely with our public health program, our MPH program, helping to develop our social epidemiology concentration. Really all of my work as a sociologist, all of my work at DePaul has been grounded in partnerships with maybe featuring in particularly partnerships we've developed with Rush through our Center for Community Health Equity, with our great partners at the Sinai Urban Health Institute. I'm very glad that Stacy's also part of this panel. Work that we've done with the Chicago Department of Public Health, especially this past year with COVID. I've been so grateful for the collaboration that we've had with Daniela Raiku and wonderful team at CDM, who we came together to develop a practical tool that answered a call from the Chicago Department of Public Health to address a very important data gap, right? They found that about 47% of COVID tests in the city of Chicago had missing race ethnicity data, hugely hampering our ability to understand the population level hit of COVID. And with Daniela and a wonderful team, including 2 graduate students, we have a statistical model that brings down that rate of missing race ethnicity data from 47 to 11%. Right? A practical, useful, real world tool that had great benefit for our city. So I've been very, very proud of that work. But let me tell you a little bit as way of introductions, some of these collaborations and how we've been able to leverage partnerships, I think, to do some useful things. So one of the core aspects of my work at DePaul has been our Center for Community Health Equity, which we started in 2015 with our great partners at Rush University. There's about 35 of us now, geographers, anthropologists, sociologists, doctors, and nurses, all working together with this relatively simple idea, right? That we can do some things together, that we can do valuable things together that we wouldn't do by ourselves. So much of that work has been academic, about research, but a lot of the work has been about communication and how we engage with communities and external partners. So we've done some work on segregation and low birth weight, which came to the attention of Representative Mary Flowers and had real, I think, impact in helping to establish and stand up a task force at the state level on maternal and child inequities. We've done things on to develop new metrics to understand the social patterning, social inequities that we have in our city. So this was a paper looking at the index of concentration at the extremes, which is a way of measuring racial segregation and income inequality as a predictor of premature mortality. And that was work that we did together with the Public Health Department, CDPH. We've done a lot of work to center social concepts like structural violence, right? A key idea, a concept that's very important to us in social sciences, but has huge applicability with healthcare and medicine, right? Understanding the social and political arrangements that harm populations. And we've translated that work. We've made it accessible and meaningful to clinicians and health systems. So this is a paper we wrote, I think 2 years ago now in the New England Journal of Medicine, looking at the concept of structural racism, which many of us in social science study and grapple with. And here was a case of how this concept shaped the lives of one woman in the South Side of Chicago and her encounter with the healthcare system. A lot of the work is about relationships. So some of the work is about data and producing things, but a lot of the work is about relationships and nurturing relationships. And here we're with a fantastic colleague, mentor, friend, Dr. Linda Ray Murray, who very kindly wrote the foreword for our 2019 book, Community Health Equity. There's a similar line of analyses that we've done with the Sion Urban Health Institute. Fantastic colleagues on the west side of the city. Many of us, Dan Schober in our MPH program, Karen Stewart in our sociology department are also involved in this work, looking at patterns of inequities across US cities and how they manifest in unequal life chances. So we had a paper come out just 2 days ago in JAMA Network Open, looking at inequities, Black-white inequities in all-cause mortality, finding that Chicago is one of the 5 cities in the United States that has a growing gap between Black and white people in terms of our life expectancies. And all of that comes together in a book that we have coming out this year called Unequal Cities with Johns Hopkins University Press. Again, all of this work is only possible if we prioritize, if we nurture relationships, both between people and between institutions. And lastly, my work has been defined this past year through a joint appointment that I'm very grateful that DePaul gave me space and freedom to pursue with the American Medical Association, where I've joined as Director of Research and Data Use in our new Center for Health Equity there. An important mission to provide physicians with the consciousness, tools, and resources to combat health inequities. And the impact has been great, not just of me, but of this whole generation of work that's happening. We have new AMA policies that recognize race as a social, not biological construct, that recognize racism as a public health threat. And this not only shapes the careers and work of the 270,000 AMA physician members, but medicine writ large. There's a huge generation of thinking and work around structural competency in the healthcare system and how we can best address the lived realities of people and communities. And again, all of that work entails communication and partnership and dialogue. And here I had the great privilege of hosting a talk, which has been viewed 43,000 times on YouTube with our great colleague Maureen Benjamins from Sinai, Ali Sewell, sociologist at Emory University, and Nancy Krieger, a noted social epidemiologist from Harvard. So again, at the core of all of my work is partnerships and collaboration. And I look forward to the conversation today about how we can best leverage these kinds of initiatives across our work at DePaul. Thank you.
Thank you, Fernando. Thank you for the introduction. Next, we have Colleen Egan is joining us from the Illinois Science and Technology Coalition. She's the president and CEO of the organization. Welcome, Colleen.
Good morning. And it's hard to go after Fernando. Being a former nurse, I had to navigate the inequities of healthcare for a very long time, and then the inequities of education as I moved into STEM and our tech, and then technology itself. So he's a hard act to follow, but we'll try. Sorry about the lag there. My wife always says as a technologist, I can't, work the TV remote. So here we go with screen share as well. So as Maya said, I am, and I'm going to go back one, the current CEO and president of the Illinois Science and Technology Coalition and Institute. I'm also a very proud founding member of the Women in Entrepreneurship Institute at DePaul University. This is our, we're starting our fourth cohort, and I'm so excited about, the support that we've got from DePaul and especially Maya. I'm also a former nurse, as I said. I moved into technology in the late 90s, and I've been a serial entrepreneur ever since as a founder, co-founder, COO, CEO. I sit on many boards, congressional task forces, and I like to think that I strive every day to be a good human, and in my spare time, I'm a pretty decent poet. So, the Illinois Science and Technology Coalition, our mission is to measure, connect, and advocate for the state's innovation economy. For those of you who don't know us, we were started 31 years ago by Governor Thompson and the state of Illinois. We were started under state statute, under DCEO, to support and be an advisor for the state in economic development. We're a shared voice for the community. Our members and our funders include many, mostly universities, and DePaul being one of our newest members. Thank you very much. We also have a host of Fortune 1000 companies, the federal labs, and through our since I came on as the new CEO in July, I developed our equity framework. I'm so glad Fernando talked about equity, because that's been a big part that's been missing, I think, with the work we do. So opening that up to smaller organizations, smaller schools, so that everyone has an equal voice in what we do. So the pillars of the work we do are data, advocacy, innovation, and education. And I'll start with data. Many of you are probably really familiar with the innovation index that we put out. We usually do it 3 times a year. We're moving to a once a year pattern at the end of this year. But we look at university entrepreneurship, then we look at research and development through the state, and then the talent supply. Our last talent event was just a few weeks ago. It was pretty remarkable as we looked at the inequities of STEM education, especially across the BIPOC community. So advocacy is our second pillar. So there we really work on increasing capacity for scientific research, promoting skilled workers in our workforce, strengthening our innovation districts throughout the state, and improving research and that connection to business. On the advocacy side, we work on policy not only in the state, but at the federal level. And if you're interested in any of the policies that we have driven through, I advise you to look at our site. Right now, we are working on an entrepreneurial voucher system that is hopefully coming up for a vote in this new Illinois General Assembly. And one of the successes, we've had many successes, but when we talk about what we're talking about today and these relationships and strengthening each other, one of those was MHub. It was the first innovation center for development and manufacturing. And so we helped them secure a $500,000 EDA Regional Innovation Strategy grant that helped launch that space. And that's led to the creation of hundreds of companies and jobs. So when it comes to innovation, we work with all of our referral partners, like I said, our universities and labs, venture capital firms, civic groups, nonprofits, incubators, and accelerators. And we create programs to support that. We work and we've got a 30-year history of doing this. Our relationships are deep. The state and the federal, agencies we work with really respect us. And so, we bring that to all of our partners and in the programs we help develop for them. When it comes to innovation, again, we used to do a corporate startup challenge that really focused on our universities, entrepreneurial centers, and the rest of the tech ecosystem and large companies, say Hyatt. Hyatt was looking for something specific for a social media monitoring platform. They found Sprout Social through us. And as we know, Sprout Social has gone on to become, the darling of the Chicago tech ecosystem and just had their IPO. I'd like to close too with our, I run the coalition and the Institute, two distinct organizations under, my leadership, but we're all in it for the innovation economy of the state. On the coalition, we work on the big people side, right? But on the in the Institute side, we work on the educational side. We support a STEM education program called the STEM Challenge. This year, we have 20 corporate partners and 20 high schools throughout the state. This is a very long 4 to 6 month program, very hands-on, creating, wonderful human beings that will hopefully stay in Illinois and go to our universities and work in our companies. We've also built design thinking into those programs. We also have a mentor matching engine, which is a proprietary system that we've built that we use with our STEM challenge and also as a separate program. It's in 42 high schools throughout the state. My goal is to get that in the hands of every high school through the state, especially during virtual learning. Because when we created this in 2012, it was really created for that purpose, to be this equitable platform. No matter where you lived, you had access to a mentor. So, currently we have 1,000 mentors from across the world, probably about 500 students this year. And like I said, we are definitely meeting the challenges of virtual learning. I'm going to stop there because I'm really looking forward to the panel discussion. And thank you so much again for having me.
Thank you, Colleen. Thank you for that introduction. We at DePaul are really excited about this new membership that we have in your coalition, and we look forward to seeing what materializes out of that in terms of partnerships for innovation. Our next panelist who will introduce herself is Dr. Sheena Erete. She is with College of Computing and Digital Media here at DePaul University.
Hi, thank you so much for inviting me. I really was looking forward to this conversation as we begin to have this conversation about thinking about partnerships. I am a faculty member in the College of Computing and Digital Media, specifically in the School of Design, and all of my work is grounded in community-based, community-oriented design and thinking about designing tools and technologies, specifically working in partnership with communities. And so I'm looking forward to this conversation as well. And so I'll just start with just a couple of things. So all of my work, like I mentioned, is community-based, and I specifically focused on thinking about issues that focus on resource-constrained communities. And the reason why I think specifically about communities and issues around less affluent communities is because we know that me as a technologist, I know that technology has the potential to worsen inequities. And many times we want to think about technology as this opportunity to improve the world. And there are a lot of technology deterministic folks, but we know that technology really does. And the more that we think about innovations within technologies like artificial intelligence, et cetera, we know that technology actually has even with the gig economy, et cetera, has the ability to worsen inequities. So, and when I say resource constrained communities, I'm actually referring to geographically bound communities, so physical neighborhoods, et cetera, that face disparities such as issues around concentrated poverty, issues such as low household income, lack of access to adequate educational opportunities and basic health and human services, as well as, the lack of public revitalization efforts, city resources, and private investment. And so in addition to thinking about the role of technology in exacerbating these types of inequities, we also know that resource-constrained communities have faced considerable social and economic disadvantages due to structural racism, structural oppression that's embedded within our society. And so much of my work really focuses on how do we design not just technologies, but technologies and practices and policies, right? So working with partners that can impact all of those things, social practices and laws and policies, et cetera, that can counter these social issues by really thinking about the historical structural oppression that exists and that was designed in this way. And then how do we do that in a way that's community-led, community-focused, and data-driven? And so I'll just start. I always like to start with just talking about my key takeaways. I only have a couple of minutes to do an introduction, but one of the big takeaways from my work is really thinking about the role of partnerships. And partnerships, they have the ability to be integrated into our research all the way from the start into the finish. And so I think a lot about my research as meta and the meta decisions that I make as a researcher, including who I partner with. How are those selections made? What's the role of structure and power in those communities? Meaning who has power in general? And so how am I making sure that voices that are not traditionally heard are actually heard in our research. And then also I think about it even in very small meta decisions, including like if we're having and hosting community-led workshops, which we do quite a bit. Who do I partner with within the community to provide services such as food services, et cetera, right? Who's photographers and cameramen, and how am I supporting the community in those types of ways, right? And then the other thing that we've done strategically is that we don't just think about partnerships as a way for us to do our work and our research, but we also think about it as how do we leverage partnerships to for the partners to be researchers themselves. So they actually come up with research questions. We pay them to be a part of our research team. We train them as well. And they also, so they engage in the analysis process of the data that we collect in a meaningful way. They also come up with what they believe to be the most useful opportunities for us to design for the output of our research. And so the currency in academia tends to be papers, grants, et cetera, which we also do, but we also think about ways to share our work with the communities in a way that's meaningful to them. And so they define what that means. The second thing is thinking about technology design and has the potential to amplify the technology design has the potential to amplify counter structures. And so communities, thinking about communities and all of the work that we do is we think about what's already existing within the local community and not just taking the narrative of a deficit approach, but thinking about it as an asset-based approach where communities have assets, where there are already organizations that are already thinking about issues like maternal health, like improving educational opportunities, like improving informal education, et cetera. And so how do we, and those are community-led counters to structural oppression. And so how do we work with and work with community organizations to build tools and technologies that support those efforts rather than us coming in and trying to support those efforts. And then the last thing is our solutions. We always think about our solutions being very sustainable and what's sustainable and how could it be situated within the local community after we leave, right? After the grant ends, after that particular focus ends after a few years, which is really important for us. And so we think about the only way to really counter structural oppression is that we commit to activist approaches and we commit to working with folks who are already doing this within community rather than just traditional methods of research. And so much of my research has focused on things like working with Chicago street outreach workers to design tools to support their violence prevention efforts. And that's an alternative. And the reason why I talk about counters to structural oppression, because that's an alternative way of thinking about, that's an alternative to thinking about traditional policing. And I don't think 2020 has really brought to light the importance of thinking about non-traditional ways to police Black and Brown communities. We worked with, the city of Chicago and UI Labs to think about smart technologies and how do we integrate that into resource constrained communities, and like how do we think about it in a way that's equitable and that's fair. We'd work with birth workers throughout the city of Chicago, and that's been in collaboration with Dr. Enid Montague, who's a faculty member at the College of Computing and Digital Media, and we think about birth outcomes, particularly for Black women, and improving the mortality rate. And how do we work specifically with birth workers who are already resistant to traditional ways of thinking about health, et cetera. And so we worked with midwives and doulas in Black and Brown communities who focus on culturally relevant ways to engage women in improving their health, maternal health. And then lastly, we've worked with creating a STEM learning ecosystem. This is a project that is supported. We think Dr. Raku and the current provost really helping support this work. This is in partnership with the mayor's office And we have tons of community partners, including Project Exploration and Natasha Smith-Walker, MAPS Course, Northwestern, and other partners who are thinking about how do we transform equity as far as STEM learning ecosystems. And we work specifically in the Austin neighborhood. But then beyond even STEM, how do we make equitable learning ecosystems across the city of Chicago using data? And so using that as an example, we run something called Community Conversations. You see the picture in the background, and this is us leading a workshop. And in this workshop, we have Chicago parks, the Chicago Park District, and leaders from the Park District. We have folks from the Chicago Library there. We have public school health, including all the way up to the chief to principals of local schools. And I say the chief, but the network chief of that particular area, who runs 14 schools in that area. We work closely with folks from public transportation, the city of Chicago, and even in Evanston. And then we have tons of community partners who actually attend those meetings. The point is how do we create an equitable learning system that's community-based and with data? And the types of data that we discuss, and what we did was create an interactive data platform where people could look at program locations across the city of Chicago of informal learning opportunities that youth can sign up for, places and what the facilities look like and what are the assets within those facilities. We look at things like walkability, crime, youth population, youth density, and even youth interests. And based on that, we talk about what are the assets within that community, and then how do we visualize the transformation of that particular community. And so I'm going to end there. With that being said, I look forward to having a fruitful discussion on the panel. Thank you.
Thank you. Thank you for the introduction. Our fourth and last panelist to provide an introduction is Stacy Ignofeld. Stacy is with the Sinai Urban Health Institute. Welcome, Stacy.
Thank you. Thank you for having me. So I'm going to talk very briefly about SUHI to kind of set the stage for my example of an innovative partnership. I will say we have a lot of examples, and I chose this one because it's one of our more recent kind of multidisciplinary partnerships that I'm particularly excited about. I do want to mention also that we just recently, DePaul and Sinai Chicago recently established a formal partnership, and we are super excited to see kind of where that goes and what kind of partnerships we can establish from there as well. So a little bit about SUHI. So the Sinai Urban Health Institute, we are the community engaged research arm of Sinai Chicago, which is Illinois' largest private safety net health system. We were founded in the year 2000 by Dr. Steve Whitman, who was a real visionary social justice advocate. And our mission is to really promote health equity via community partnerships, data-driven research, and innovative health interventions. We really work at the intersection of public health and population health. We've also gained some national attention for our work towards closing the health disparity gap in Chicago, and also our expertise in hiring, training, and providing skills for the community health worker model that I'll share in just a little bit. So this is a slide about our SUHI model. On the side of the health equity and assessment research, our mission here is to really co-create knowledge by, for, and with the community in order to mobilize stakeholders towards health equity. In the middle is the Community Health Innovations team, which I am the director of. And with this team, we do address health inequities by developing innovative solutions. And then under the evaluation arm, we utilize high quality, culturally responsive, and equitable evaluation support and capacity building with our partners. On the health innovation side of things, which I'm going to talk about, we have utilized the community health worker for about 20 years since our founding. And for those that aren't familiar with community health workers, this is the definition. I won't read it, but this is the definition from the American Public Health Association. CHW models have been proven effective in disease management, health system navigation, in decreasing healthcare costs, in helping to improve the social needs of the communities we serve. In the simplest sense, CHWs are really serve as the link between the healthcare system and the community at large, really meeting people and individuals where they're at. CHWs often do a lot of their work in the community and often in the homes of the populations that we're serving. As I mentioned, over time, we've developed expertise in the community health worker model and in the training of community health workers. So we actually have a center dedicated to that, the Center for CHW Research Outcomes and Workforce Development. And that in and of itself, we have, kind of really developed some innovative partnerships through that center with other organizations, public health departments, payers, in order to train and upskill the community health worker workforce. And building upon that 20-year experience with community health workers, we have just launched an initiative where we are, this is a great partnership opportunity, innovative partnership example of, we're trying to develop population health career pathways. And the goal of these pathways is to really increase access to a bilingual and culturally competent healthcare workforce. Given some of the data that, 21% of our Latinx in Chicago are living in poverty. We have a 31,000 median household income in the community of Little Village. And that there's a lot of opportunity for healthcare jobs. We really decided that, with our partnerships, that we wanted to expand these health careers. And really targeted towards those Latinx job seekers with a high school diploma, and targeting the population health. We know that if we don't have a linkage between the healthcare and the community, we're not going to make any impact on decreasing the inequities in Chicago. So we're really seeking to develop systems for training, mentoring, career support, and also placement mechanisms for Latinx job seekers on the west side of Chicago. And where does the partnership come in? We have really designed this model where we are co-creating this with all of these various stakeholders, stakeholders in the workforce development space to bring linkage to employers, best practices in workforce development, other resources that are available through government funding and things like that. Academics to really help us think through the pieces of higher education, bring a research research focus to what we're doing, community-based organizations who are the linkage to the individuals we're trying to reach through this effort, and who do employ, workforces in population health, managed care organizations. They have a big stake in creating something that can help really improve the healthcare, the federally qualified health centers, as well as coalitions and other collaborations such as Westside United that we are working with, who are also working in the workforce development space. And I think, an important voice is our Community Advisory Board, which we are going to be seeking input throughout. And so I really highlighted this because we thought through those partnerships that we would need to be successful. We are really co-creating this with all of these diverse organizations and lenses so that we can really make an impact to eventually improve population health, bring that bilingual and culturally competent healthcare to our communities. And so I will stop there. Thank you.
Thank you, Stacy. Thank you to all of our panelists for these introductions. If I may ask all panelists, if you can please turn on your camera. And we're moving on to the question and answer part of this panel. A reminder for our audience, if you have questions you would like to ask of the panel, please use the Q&A button at the bottom of your Zoom screen, and we will get to those questions in the end of the hour that we have together here. So thank you everyone for your introductions. My first question for all of you, given your extensive experience in partnering, what would be your advice to an academic, maybe a fresh academic at DePaul, who is looking to collaborate with an outside organization but does not have prior experience from any such collaborations? How should they go about the process of finding a partner and exploring common interests with a potential partner? And I'm not going to nominate anyone specifically to answer. You can unmute yourself, maybe all at the same time. We'll figure it out.
Sure. I'm happy to go first if it's okay. I jumped on the button
Please
first.
do.
But thanks for that thoughtful question. And of course, there is no one right answer to this, right? All the context is going to matter. The particular topic is going to matter. But I think what has helped me is just to always approach partnerships and collaborations with as much honesty and transparency and authenticity as possible. Also, just to try to reach out. The very first seats of our Center for Community Health Equity between DePaul and Rush really started with me going to my local bookshop, hearing David Ansel as he was speaking about County, his first book. I didn't know who he was. I was new to Chicago. I think I was here for 2 months when just by chance I came across his book reading. But something grabbed me, right, about the book and the way he presented it. At the same time, I had just written something on the same concept of structural violence. So I just reached out to him. I wrote him an email, and he responded and very kindly invited himself to come speak to my undergraduate students. And then, it took about 2 years of just communication and like little bits of projects here and there before we were working with other colleagues and eventually approaching our provost and our president to do our joint center. So, and I think that applies to other people as well, that relationships take a long time. You have to build trust. You have to find areas of mutual interest. And we have this huge advantage, right? We're a social justice institution. Not every university is. So we approach communities, we approach partners with particular values. And I think if we make those up front and center in the core of the relationship, we can go a long way.
Yeah, I'll jump in. I completely agree with Fernando. I think that a lot of times when we think about our work, we think about our work, right? So how do I collect more data? Or how do I, so I need your partnership so that I can get what I need, right? Or what we need from the academic standpoint. And I think taking if you want a partnership, taking it slow, taking a community approach where you make it very clear on what your interests are. So I know that we are many times bound by our funding resources, or, the things that are, I would say, our currency, whether that's papers or et cetera, and what we need, but making that, like he said, very clear, making those things very clear, but then also hearing and really thinking about how can I integrate what the community needs into this. The other thing I think for me, I think a lot about is that I don't think about a partnership as being a very short-term relationship. It has to be a minimum of a couple of years. And I think a lot of times if you're not willing to spend a couple of years, or if you just need people to collect data, that's not necessarily a partnership. And you just have to acknowledge that I'm not looking for a partnership. I'm looking for subjects, or I'm looking for participants in my study, right? But a partnership is actually a long-term relationship that you can always come back to. And I think like recognizing that relationship, that some of the work that you might have to do for that relationship may not directly relate to the currency that we as academics have, and that's okay, because you're trying to build a long-term relationship with someone. The other thing is like, obviously at DePaul, there's a tons of opportunities and resources to work with the STEAM Center. They've introduced us to partners that we've worked with and have continued to work with long-term. I've been on some of those partners' boards now, now that we've worked together. And so I think that working with the STEAM Center and trying to understand that, getting a memorandum of understanding with I always try to do an MOU, whether that's formal or informal, to say, here's what we're looking for, here's our goals, here's what I heard you say your goals are, do we have this correct, right? Like, is this something we want to move forward to? And then also I would say, I also try to have short-term short stops, right? So I wouldn't jump into a long-term grant on a partner that I don't know, you know, a 3-year grant, and we've never worked together. I would say, like, normally I try to start with, you know, a little teaser, a little, you know, let's work together for 3 to 6 months, try to see if we can get some data down, you know, try to see if we can do something collaboratively and see how this works out, because it might be a fantastic relationship, or the organization might change and shift, or my interest might shift, and it may not be a good partnership for the moment. And so I think, like, just really spending that time to build that understanding before you jump into something long term, and then understanding the difference between I need a partner and I need you know, participants, is like really key.
I just want to jump in. I agree with all of what has been said. And I use the term co-create a lot because I think that is a really important word to use when you are discussing partnerships. Because if you come in with kind of this preconceived notion of what you are going to do without listening and trying to develop something with the community or with another organization you're working with, you know, it's not going to be as effective as if you come in knowing your interests, you know, doing your research, networking, listening, and really co-creating something that is going to work to the benefit of all those involved.
I'm just going to close this question out by saying that I love what everyone has said, because for me, these are journeys. You know, like I said, we're creating these partnerships, but, like, you know, getting to know someone, getting to know that organization's values, making sure your missions align. But I wanted to say something else that people can do right now, which has been phenomenal through COVID. We've been talking a lot about equity, right? There's so many summits and expos and, you know, talks and events that people could never afford to go to before. You might have to fly there, you know, you might have to get a hotel, timing. I mean, I just love in the city now, I can have 40 meetings in one day instead of 10 because I'm not rushing all over, right? And so we've got this, I love this new normal of, you know, everybody being able to go to that summit and meet people. And for, you know, I can only speak for myself. I'm a, you know, person who loves to meet people. For an academic, don't be afraid to go up to that person and say, I really love what you said. Like Fernando said, something in someone's book inspired him and connected with him. You know, I give a lot of speeches and I might say one thing that someone connects with, and they just reach out and say, hey, I heard you, can we have a discussion? I'm open to all those discussions. And sometimes they lead to an amazing thing. Like we create a program by the end of that hour discussion, or we just agree that this is a great journey. Who knows where we'll be 6 months or a year from now. So make sure you just go to a variety of events, meet new people, expand, you know, your networks, and see what comes from that.
Thank you all for weighing in on that question. I love the answers and the long-term emphasis, the importance of authenticity and trust and all of that. Thank you for highlighting those points. I'm actually going to pick next a question from the audience to make sure that we have time for some of these questions as well. So, and this is related to what we already talked about. So Marilee Thomas is asking if, just a second, I have a tech issue here. Do you find more opportunities to collaborate across academic disciplines and the business community now at the time of the pandemic than before? And I guess the other side to that question would be, do you think the pandemic has maybe slowed down partnerships? Do you think it has had any impact? And if so, what kind?
Can I lead off this one? Because for me, I came in a pandemic. I'm the newest CEO of the ISTC. I was like interviewed, hired, you know, never met my team, my board, and thrown into COVID, right? And for us, you know, we support the innovation economy of the entire state. So for me, it was like a whirlwind of meetings and new relationships and new partnerships, and how we not only, you know, survive COVID, but how we move into the new COVID economy, how we move into the, you know, new tech economy that we have 5 years from now. So for me, it's been a whirlwind of activity. I had to give a speech a couple months ago, and I was like, many things in our world have stopped, but innovation never stops. And in fact, we've become more innovative, more creative. And, to everyone's point, I've worked on the healthcare side, the education side, the tech side, gender equity. We talk about inequities. I love that, all of this has bubbled to the surface and that corporate America can see what's going on. I think even in my own circles, people who never thought about these things, they hear me screaming about it all the time, but they really don't pay me any attention. Now they're really paying attention. So I think there's this whole new movement, and I think COVID and unfortunately the murder of George Floyd has really pushed. And I can only hope, someone asked me what I was most worried about with COVID ending, and I said sustaining this momentum as we move through it. So that's my 2 cents. Thanks.
Yeah, I agree with that. I think our things have accelerated, and at Suhi too. And we've, not only is our staff growing because we have more projects and more initiatives we're involved in, but one of our team members asked if it's always this busy. And I said, I'm the busiest I've ever been in my career right now, because there is so much, there is a lot of innovation. There's a lot of partnering with these diverse organizations. And I think the virtual world has just opened up. We're not only partnering locally, we're thinking about things that nationwide, even internationally. And so I think just being in this virtual world alone has opened up a lot of partnerships that maybe folks haven't thought about before.
Yeah, I'm just gonna echo that. I would agree. I think it has opened up. I think also if you're working on different projects that are non-COVID related per se, it's shifted it because it really just exposed, inequities in a whole different way. And I think that if you are open to being flexible and co-creating an agenda, like Stacy mentioned earlier, I think it's a great opportunity to continue doing the type of work and continuing partnerships. And I think the folks that I have seen had trouble typically are like very rigid and staying in whatever they need to stay in, as opposed to being able to pivot and saying like, oh, I can explore. It doesn't necessarily have to be, because I think all of our solutions should like sustain beyond COVID, right? But I think that if I have a partnership and my organization has to shift because of a pandemic, then I have to also think about ways that I can potentially shift to continue to work with that organization, right? I don't want to push my agenda as opposed to really thinking about what's going on in the community and what they're experiencing and what they're feeling. And so I've been able to shift pretty easily because, we've never gone through this at all. And I think that we can continue to I think for most part, this is a really ripe time to start partnerships, to continue partnerships. I think continuing partnerships is really great. And I think some organizations are experiencing, particularly community-based nonprofits, are maybe experiencing issues with, financial issues, et cetera. And I've tried to be very sensitive to that and thinking really about what they need and thinking about how can my work support them, as opposed to, whatever project we were working on, because it probably was non-COVID related before that.
Thank you.
These are all
Fernando,
great
did you want to
points.
weigh in?
Yeah, if I could just offer one insight. I've been joined by my great collaborator here, but I've seen so much creativity from traditional academic partners and also the business community in terms of data and research. So several of us, including colleagues from Sinai, from Rush, have been collaborating on the Racial Equity Rapid Response Team data work group spearheaded by CDPH. And there, we've had contacts and collaboration with companies that track cell phones, right? So that they can track mobility and how social distancing is working in different communities, how we're congregating in particular institutions and mobility patterns. And those are kinds of data that maybe traditional public health folks haven't looked at before, but we've had to look at it in great depth here. And we've only been able to do that because companies are looking like to make their data available, to make it available for the common good in this devastating time. And yeah, this applies to COVID. It applies to the response to the murder of George Floyd and institutional reckoning of both institutional racism and racism in society. Organizations of all kinds and stripes have issued declarations against racism. And now there's a huge conversation around how accountability is built in, right? And what kind of data, what kind of partnerships are needed to make those pledges and those promises real over time. So it's not just a declaration on paper. So it's a really exciting time in many ways.
Thank you for weighing in on that. I have another audience question here that I will ask of you all. Catherine Ibata Arens is asking a question about a way to integrate undergraduate students maybe in our partnerships. And so the question is, any ideas of creative ways to involve DePaul undergraduate students in meaningful internships or experiential learning? And I would add specifically in this context of partnerships.
I'll start again. I'm very grateful to DePaul. We have a new intern from DePaul that just started yesterday, so thank you. But one thing that we've looked at, like I said, I have the coalition and the institute. And the institute really focuses on K through 12 education. And then we focus, of course, on higher ed and, our workforce getting through college, going into jobs, keeping them in Illinois. But we, started really looking at, talking about equity. We created our equity framework when I started because it's important to everything we do, and looking at the gaps and how we fill those gaps. And when it comes to undergrads, we had seen that there's that transition from high school to that freshman year of college. We know how strenuous that is. And, my parents didn't go to college. They were immigrants. I mean, they grew up in orphanages. They did not know how to navigate the system. So how do we help high schools or first year college students navigate freshman year? How do we help get them into mentorships that can really help life coach and career coach, and then move them into internships fully prepared, and then move them, or maybe job shadowing and then internships. So this is something that we're thinking about how we can help the undergrad. We've never really been in workforce development before, but there's a huge gap that we can fill because, like I said, we've got the data. We have those relationships. We, of course, listen to our partners. We don't create things just to create things. We really want to create things for long-term impact. And so just the undergrad thing, that's what sparked in me that's something that we're really thinking about building. We're talking to our corporate partners now, our nonprofit partners. We don't want to recreate the wheel. We want to create something that's amazing. And I would love to partner, maybe beta test with DePaul students to see how it works. So that's what we're doing to get undergrads in, to hear their voices on what they need.
This experience is at the graduate level more than the undergrad, but with the MPH program, we've had great success in putting students in 9-month practicum placements, including at the Sine Urban Health Institute. And those kinds of experiences are so important, right? It's where the classroom really comes alive, where students learn the real world difficulties, and they come across problems that they don't necessarily know the answer to, and that's the beauty, right? To see them work through that struggle and continuous learning, and certainly partnerships are the only way of making those kind of opportunities possible. At Sinai, they've been at Rush, and also now we have 2 placements at the AMA. And those maybe work at one level with graduate students, but they're also possible with undergraduates, particularly for shorter spurts of time with more constrained projects. But we've had success at that level as well.
All right. Thank you. Stacy, did you want to weigh in on this one still?
I just wanted to mention, in addition to DePaul, we've worked with some other universities to have interns, and yeah, we're always open to that and really value having, both our opportunity to work with students, but also having students have that kind of real world experience. So we definitely have done that, and we'll continue to do that in the future.
Thank you. I wanted to finish with a quick round. I want to hear from everyone. We have 5 more minutes left of this panel, but so we're here at DePaul, and many of you have talked about DePaul and the qualities that the university represents. If you can please briefly comment on what do you think is a specific advantage that DePaul has in partnering with outside organizations for innovation that is maybe uniquely DePaul? Can we finish with this question?
I'm happy to go first if that's okay. But I think one of the things that is unique about us is that, you know, being a social justice institution, we're not a research intensive university, and I think we should be upfront and okay with that. That we can do very meaningful work without requiring a huge external grant. Of course, grants are great, and we'll happily apply for them, and we'll build those in. But we can do meaningful work with our partners and our communities without that huge infrastructure. Leveraging our strengths, leveraging our footprint, you know, as a well-established 100-year-old institution in Chicago with a tremendous alumni network, right? Everywhere you go in the city of Chicago, you come across someone who graduated from DePaul. And that's a huge, huge strength that we can draw on to work together.
Yeah, I'll jump in as well. I think for me, it's there is an infrastructure to help support partnerships that's very strong. Again, I mentioned the Stain Center, who, you know, tries to do that from the student, but also from the faculty level. I think that even the Office of Advancement has tried to think about ways that we can incorporate partnerships and community partnerships. I also think, like Fernando mentioned, the relationships that DePaul already has. And I think that there's a strong commitment within the university from their internal opportunity for the small grants that can actually can get a project going and started, right? So from the small grants for faculty and for students to support transformation within the city of Chicago. And I think that the mission of the university really does focus on, and I think across, at least I've found in the 8 years that I've been here, that there's a commitment to the transformation and working within the city of Chicago. I also think our location is beneficial. I was at Northwestern before, and it's really nice to just be in the city and be a part of the city and the feel of the city. And I think that that has a strong impact, but also the history of the university as well, as far as giving back to the community. It has a good reputation for doing that. And so, yeah, I think the infrastructures that are in place really do support folks who want to get started in building partnerships and relationships.
For me personally, you know, Fernando hit it on the head. It's the social justice aspect, right? And the legacy of work that DePaul has done and that reputation. I mean, I am not, you know, a teacher at DePaul. I did not go to DePaul. DePaul came to me and we aligned. And I mean, it was a huge motivating factor for me to, you know, become a founding member of the Women in Entrepreneurship Institute. And I think in itself, there were 40 of us and we all put our own money in to make that happen, right? And we still continue to do so. And that's the kind of commitment I think that DePaul, you know, brings. So partnerships are easy to do with DePaul.
I think that from Sinai's perspective, I know we have an advisory group that kind of talks through some of our partnership opportunities between Sinai, Chicago, and DePaul. And it really seems like there's a strong alignment in values in the, you know, the improving urban health, focusing on the most vulnerable populations, really interest in bringing multidisciplinary teams together. And really, you know, focusing on solutions. So I know through our partnership development, I think those are some of the things that have really come to the forefront in the discussions.
Thank you. You've been an excellent panel, not only because you've shared some wonderful points of view, but look at the time. It's 11:45. We are right on the dot. Thank you to all of you panelists. I very much enjoyed hearing your perspectives. I know the audience did as well. If in the audience, if you have questions that are specific to the work of any of our panelists, their contact information, I believe, is available on the Innovation Day website, so you can reach out to them afterwards. I would like to thank the organizers of the Innovation Day for inviting me to moderate this panel. I learned a lot.